So actually, I'm from Psychosocial Initiative. I'm the main trainer there. And Integrative is my collaborator. So we actually are partners in that sense. Okay. So I'm going to bring you through some of the information about psychological first aid and how psychological first aid is important after crisis. I think some of you already have known me because I was previously a Red Cross. So when I have questions to ask, I won't just wait for you to ask. I will actually name some people, and you actually have to ask. So you need to be alert because your name might be called anytime. Yep. So before we start, let me just give you a quote from this guy called Stacy Colino. Don't ask me who he is. Frankly, I don't know. It's just that his quote is nice. So he says that PFA is actually the same like first aid. And all of you are first aid trainers. So you know the importance of first aid. I don't need to emphasize to you how first aid is important. But I want you to think in this respect. Just as physical first aid is important, psychological first aid is important because it is exactly the same concept, except it is in a different context. Okay? When you have an injury, when you have heart attack, when you have a fracture, when you fall, you administer first aid. And we all know that it's important, we all need to know first aid. But how about when you actually have emotional hurt? When you have psychological injury? When you have a mental wound? Things that you cannot see. Bleeding, you can see the blood. The cut, you can see the fracture, the guy is sitting down there cannot move. But all this psychological injury that you cannot see. But it's the same way how physical first aid actually render help to that person. When the person is emotionally hurt, if you actually render psychological first aid, it helps in the same way, exactly the same way. So all of you are first aid trainers, right? So let me test. We all know that first aid, there's 4 main objectives. Right? Right, the 4 P's, right? You all should be like, close one eye also can answer, right? The 4 P's or the four objectives of first aid. So what's the first P? Preserve life, exactly. Now, if you actually move that preserve life in the context of psychological first aid, what are you preserving when you do psychological first aid? What are you preserving? You do CPR to preserve life. You do psychological first aid to preserve what? Brain? Wow, can preserve brain. You're doctors. What are you preserving when you actually do psychological first aid? You're actually preserving the emotional stability of that person. You're actually preserving the sanity of that person. Same context, right? Second P. What's the second P when you do first aid? Again? Preventing the condition from getting worse or preventing further injuries, right? Now, when you do psychological first aid, what are you preventing? That one basically the same answer as the first one lah. What are you preventing when you do psychological first aid? I fail an exam. I'm so distressed, I'm so affected. When you come and give me psychological first aid, what are you preventing me from becoming? What is the further injuries in that sense? Yep, I heard depression and all those stuff, right? Serene just now talk about trauma. So basically, when you do psychological first aid, but the keywords is this, there are 2 keywords here that you need to focus on. Timely and effectively. You cannot just think just because I do psychological first aid, you actually can help to prevent this. No, it must be done timely and effectively. You actually can prevent the onset of mental illness. You actually can prevent PTSD. So internationally, when we talk some more later on, psychological first aid is the first interventive in any PTSD cases because you actually can help to prevent that. The third P, what's the third P? You preserve life, you prevent injuries. The last one, provide what? Provide recovery, or you promote recovery, right? In terms of psychological first aid, what are you promoting when you do it? Okay, how does mental recovery sound like? It's right, it's true, but what is the key word when you talk about mental recovery? What are you promoting? Resilience, exactly. So you can see, physical first aid, we all agree is important, everybody must learn it. Psychological first aid is important in the same sense, in the same context, in the same concept, right? But it applied differently in that sense. So, crisis happen. And of course, crisis differs from person to person, right? Some people who may be younger, losing water bottle can be a crisis, right? Adult, maybe losing a house is a crisis. So crisis differs from person to person, we all know that. But generally, after a crisis, what happens is this. So it can last from immediately after the crisis, 2 days, or hours, or 2 days. Sometimes it can last all the way to weeks. And then it can last to more a month. Okay. How does PFA come into context? Okay. When a crisis happens, people react to it. So when you are feeling distressed, you're not yet traumatized, because something happened, you just cannot be traumatized on the spot. You must take certain time, right? So when you are distressed because of the crisis, this is a normal reaction. And usually, normal human being or normal reaction will last weeks, 2 weeks, maximum maybe 3 weeks. After that, it will actually get better. But if your crisis or your distress reaction persists to months, then that's a challenge. So how do we support? So when it comes to hours, days, and week, the first response you come in is to provide PFA. That's why PFA is like physical first aid. It's the first response you go in, right? So, but this only pertains up to a certain point. If the reaction now goes into weeks and more than 2 weeks, right? This is where you know PFA no longer can be rendered because the person needs more help than just psychological first aid. And this is where we call it targeted support, which is in the form of counseling. Just like when you are a first aider, you respond to the CPR. After you've done all the CPR, the resuscitation, whatsoever, you know the person needs more care. What do? You get the ambulance, right? You send him to the hospital. And this is where the targeted support comes in, the counseling. The person, you already kind of like do the PFA, and you think the person needs more help, you need to refer to the professional with the counseling. Now, after the hospital say, oh, this guy, he needs more specialized treatment. Then you go and send to the specialist. Likewise, if the person needs more targeted support, specialized treatment, then you send for psychiatric intervention. So there's always a progression of help that you can support. But again, here we're talking about the first response is always PFA. So PFA exactly like first aid. That's the first thing you do before you refer to the paramedic, before you refer to the hospital, before you refer to the doctor. So this is what we call the mental health continuum. Okay, I often try to use this to explain how PFA is relevant within the whole mental health spectrum. So we see we have a range of mental health situations in our life. So those at the end are called, they already have mental illness, things like depression, obsessive-compulsive behavior, and so on. While on the end, people are well, they do not have this, they are functioning well in their life. But most of us, we are actually on this line and we don't stay. We kind of like move up and down according to situation in our life, right? So when we are actually moving towards end of the year, Christmas, long holiday, bonus, we're all moving towards the well part. Agree? Right? But maybe for some of you, during certain end of the month, when the bills are coming up, or when the reports due, you're all moving towards that side. Right? So we are all moving along this line. So now, when does PFA is being applied? PFA is relevant when you are already reacting. Something happened, you lost your wallet, you lost your loved one, or you got fired from your job. These are the things that happen in our life situation, and then we start to react to it. Once you start reacting to it and you have difficulty trying to actually cope with the changes, this is where psychological first aid can come in. Right? And it ranges all the way to until you're being injured to a certain extent. But the injury is more serious, you need professional. This is where targeted support comes in, which I say counseling. So you know when you are first aider, you know there's only limited role that you can play. Likewise, when you're a psychological first aider, you're also limited roles that you can play. You must know when you need to hand over to the professional. I often tell this in my class, please don't try to be a hero. Okay? Maybe for first aid resuscitation, yes lah, because it's a clear-cut procedure, right? In terms of resuscitation and so on. But in psychological first aid, you don't think you can solve everybody's problem because we can't. Something about the mind is a bit more complex than that. So if the person is really into this, really getting quite ill, this is where targeted or specialized treatment is needed, which is a psychiatric intervention. So you must know as a psychological first aid, when is your limit, when you need to know when to pass over. Any question at this moment? Am I going too fast? Yeah. You all happy, right? Can Emily, right? Yeah. Okay, this is a bit more complex. So this is called the Mental Health and Psychosocial Support Framework. In short, MHPSS. So what all this thing is about is, internationally, whenever there's a disaster or emergency, international agencies, when they come in to actually provide support, they actually follow this guideline under the MHPSS guideline, or we call it MHPSS framework. Okay? Under this framework, when something happens, let's say, what is the major crisis in Singapore recently? COVID, lockdown. Remember the first time COVID lockdown? People rushed to buy toilet paper. Right? And my friends on the west, all the shops here run out toilet paper. You see, you go to the east side, Geylang, plenty of toilet paper. And it's true. You just go to any shop in Geylang, there's plenty of toilet paper. But when that happens, it's a crisis nationally. We all are affected. People who actually need basic services at the bottom are a lot. Right? But they don't really need PFA in that sense. They just need all the practical stuff. The second layer is where people need to be connected, because when you're locked down, I cannot visit my mother, I cannot go out and sit under the void with my neighbor. So people are affected in that sense. You need to provide some sort of help to connect the community. And that's where Serene said connection is very important. Right? That's where then people start using Zoom. You call your mother, because you want to see the face, you start using Zoom and all those stuff. Then, the third layer is where people who are more affected, because the Zoom is not enough, the toilet paper is not enough, you need more than that. So you need to actually then start giving psychological first aid, because people start to be affected emotionally and psychologically to a certain extent. Then the last part is where you have specialized treatment, because people are more affected than the rest of us. So these are the different layers of response you need to give and be able to identify within the response framework. So after disaster or emergency, crisis, right, what is the common needs? It's basically basic needs, health services, medical services, information. That's why our government during the COVID lockdown, every day give you update how many are affected. They even have a map, I think, like which area has rate, and more people go to shopping center, which people didn't go to shopping center. Because information actually help people to make decisions. Should I go out today or do I go out? Can I go to the shopping center? Do I visit their places? When people feel they have control over their decision, they feel psychologically better, and that helps. Then the third thing is that they need connection. They want to contact their families. That's why they want to visit their families. They can't. I remember for 2 years, Hari Raya, people cannot go visiting, right? Yeah. So apparently a lot of people are affected. I'm not affected because I have nobody to visit. Yeah, quite a loner, said that. Okay. And of course, being able to connect to your own religion and culture. When the COVID was at peak, people cannot visit mosques. A lot of people are very affected. You can see all the elderly Muslim men and elderly Muslim women who always spend time, because they're retired, they always spend time at the mosque. They are very much affected because they feel they're disconnected from their own religion and culture. And then being involved in important decisions, like, you just decide when to lock down, when to open. You decide when is it okay to dine in 5, when is it 3. All these things people are affected because how come you make decision without telling us, and keep changing. And they call what? Prata, right? Flip-flop. People are affected because they feel they need to know the decision-making process. It makes them feel better. So people, when after disaster, after crisis, these are the things that they need. And knowing these factors actually help you when you try to provide a response. You come and help a person, you will know what kind of information that can help, what information doesn't help. Because sometimes giving too much information doesn't help. It actually makes the person more worried. So I give you an example. Let's say your spouse or your father, okay, let's say father, got into an accident and then he was brought to the hospital. So the thing that you need to provide information is that the hospitals are taking care of him. They're going to perform a surgery. Do you need to tell the person the details of the surgery? They're going to actually do 12 stitches, and there's going to be blood transfusion. All these details are actually cause the person to be more worried. So as a psychological first aider, you must be discerning enough to know how much information to give so that the person feels secure enough, I know what's going on, and yet overwhelmed by, wow, so many things they're doing. Is it really that serious? So all these things we actually inculcate when we do the PFA training, when we train people on how to provide or how to provide psychological first aid. So these are the elements of psychological first aid. Actually, these are the elements of psychosocial care. Okay, a lot of people taking photo. Okay. Anyway, why don't take photo of me? But no, I'm joking. So a bit of history of psychological first aid. So psychological first aid was developed quite long time ago, in the late 80s or early 90s, right? But it wasn't actually quite famously used. It was just left on the shelf for quite some time. But it became popular after the September 11 attack. Because of the sheer numbers of people affected because of the September 11 attack, and people realized that there are not enough professionals in the mental health field, not enough psychologists, not enough psychiatrists, not enough counselors to provide help. Then say, okay, what can we do to provide quick training for the people so they actually can respond almost immediately? And that's why they actually found psychological first aid. So this concept of psychosocial care was developed by this guy who was heavily involved in the 9 September 11 attack. So after the whole thing, he did a thorough study and research, and he came out that actually, we all think after something major happened, a lot of people will actually develop PTSD. And it's not true. Because people are actually quite resilient in their own ways. Of course, that can be debated nowadays because a lot of people say our youth today are not as resilient as our forefathers because of many, many external factors, right? But he actually came up with these 5 elements of psychosocial care, saying that after every crisis, what people need are these 5 things. And I think it's very much aligned to what Serene just shared about the different principles of trauma-informed care. So people need a sense of safety, totality, psychologically, physically, and everything. So they need safety. They need a sense of calmness. And this is very important because calmness is actually contagious. I don't know whether you realize that. Imagine someone in this auditorium suddenly just stand up and scream. How would you feel? Yeah, you may suddenly just start screaming. You all were like, what's going on? This is something that I did not see. Right? So calmness actually is very contagious. So when you respond to a crisis or emergency, it's very important to create a sense of calmness. I have no video to entertain you like Dr. Gabriel, right? And I have no video like Serene, but I'm going to tell you a personal story, how calmness is so important. And this is my own personal story. Are you okay? Or you just want to end this quickly? Okay, you don't went done with. Okay, no, so it's okay. So when I was secondary school, I was not a very good student, as you can tell. So one of my favorite pastime when I was secondary school, Sec 2 to be precise, is actually to go to shopping centers and play hide and seek. Okay, don't ask me why we play hide and seek shopping centers. We were stupid kids back then. So every Saturday after CCA, we would actually go to Center Point and play hide and seek. And as you can tell, I'm quite old, so during my secondary school days, Orchard Road is the only place you can shop. There's no neighborhood shopping center. So the in thing is to be at Orchard Road, Center Point for teenagers to hang out. But again, I don't go there to shop, we go there to play hide and seek. So this was one Saturday afternoon, nice afternoon, we went there to play hide and seek. There were actually 6 of us. So the girl who pasang, you know pasang, right? The girl who actually covered the eyes, right? So her name was Lucy, okay, my good friend Lucy. And then the rest of us would scramble the whole shopping center to actually hide. So 3 of us went all the way to the 5th floor. So during that time, Center Point was 5-story, and now I think they changed. So we went all the way to the top floor, to the 5th floor, because we thought we don't want to be the first one to get caught. Because the first one to get caught will pasang next, right? If you know the game. I doubt any kids play hide and seek anyway, nowadays, right? So we went all the way to the top floor, 5th floor. So after we count about 100, we know now that Lucy is going around shopping center, finding for us. And in our mind, we were kids, right? In our mind, we said, she'll be going escalator one level by one level by one level. And the best way to avoid her is actually to take the lift, go all the way to the 1st floor. So she'll be going up, we go straight all the way down. Okay, that's the best way, our thinking. So we all went inside the lift. So 5th floor, we went to the lift, only 3 of us. 4th floor is stopped, people come in because Saturday afternoon, crowded. 4th floor is stopped, 3rd floor is stopped, 2nd floor is stopped. So it was a full lift. When it reaches the 1st floor and the door opened, guess who is in front of the door? Yep, the girl who was searching for us, Lucy. Now remember, we were playing hide and seek and we were kids. So when the door opened and we saw Lucy, what do? Scream. We scream. Ah! And when Lucy saw us, what did she do? Scream. Ah! What did the rest of the people in the lift do? Every single one of them screamed for no apparent reason. Suddenly the lift was like, ah! It didn't last long. It only lasted maybe about 2-3 seconds. Now the thing is that when they started screaming, we stopped. Because we realized, oh, what have we done, right? So we just stopped and we pretend like. And this Lucy, of course, ran away. Disappeared herself, because scared already. And then when they stopped screaming, strangely, every single one of them looked up to the roof. Maybe they thought we screamed because the roof is coming down. I don't know. But again, when they look up, we also look up. You see how human we are so attuned, we just have this herd mentality, we follow. They don't know why we scream. They have no idea, but they scream. So it just takes one person, when a crisis happens, it just takes one person in the whole crisis lot to start reacting negatively, and the rest of the people will be affected. So sometimes in PFA, we say, okay, we want to promote safety. We do all the necessary things, but we must remember you need to promote calmness. You need to make sure everything is calm. You need to make sure the way the person responds is calm. Because if not, emotions will get affected, and emotions are highly contagious. Then we want to promote sense connectedness. Who can you call? Is your parents available? Okay. And then you want to promote a sense of efficacy in the community. And last, you want to promote hope. So, yes. Basically, in summary, PFA is a psychosocial approach that aims to provide emotional support. So the key word is emotional support. After a crisis by any trained person. So any one of you here, you don't need to be a psychologist, you don't need to be a counselor, you don't need to be a psychologist or psychiatrist. You can do psychological first if you are trained. The important part about being trained in psychological first aid is not so much about what you can do, but more importantly, what you shouldn't do. Because a lot of us don't realize that you say the wrong thing, it actually triggers more emotion. You say something wrong, you trigger more emotion, right? When people are in stress, when they're in crisis, they're stressed. When people are stressed, they are very sensitive to certain words. So you've got to be careful of that. So when we talk about emotional support, it's a huge thing. What exactly is emotional support? And this is why PFA is quite tricky. Because when I say something to you, you feel comforted. Oh, thank you for saying such thing. You understand me. I say the same thing to another person. The person says, what are you talking about? You see or what? People react differently to certain words. And that's the challenge of PFA. There is no one standard. When I do training to a lot of my first aid instructors, when I was in Red Cross, people ask me, can you just tell us the step, the exact guideline? I say, PFA, there's none. Because how you react, how you respond, depend on the affected person. Some people respond better when you give more information. Some people, you give more information, they react negatively. There is no one correct way because people react differently. And I often use this quote, my own quote actually. Life is complicated. Agree?
Yes.
Right? Humans are complex. Agree?
Yes.
Complicated plus complex, what happened? Chaos. So we must know how to manage this thing very well so that we can then promote calmness and make sure everybody is being addressed and helped effectively. So PFA is evidence-informed, consistent with all the research, endorsed by mental health professionals internationally. I'm not sure about Singapore, but internationally, yes. And has replaced all critical incidents debriefing. All psychological debriefing has stopped. All this has been replaced by psychological first aid. Main objective is to reduce distress reaction. It's basically to promote resilience by actually helping people to adapt long-term and short-term, applicable in any field setting for every age, because we actually promote cultural sensitivity, appropriate for all ages, and culturally informed. Yes. We have come to the end. I'm sure you're happy now. Yeah.